watching Canadian Muslim news on Muslim Network TV. From Toronto, Ontario, I'm Catherine Bullock. Assalamu alaikum and greetings of peace. Today a conversation about mental health and suicide in the Muslim community. It could be a difficult conversation with Imam Abdul Hai Patel. Trigger warning, if anyone feels stressed, to stop watching and to call a helpline whose number we will show. Before we do that, some news headlines. Freedom Convoy raises over $5 million on Christian crowdfunding platform. Canadian Interfaith Conversation launches online story platform to shine light on stories of faith. Fauzia Baig hired as first Director of Equity, Diversity and Inclusion in Waterloo, Ontario. New platform to fight Islamophobia launched in France. Now the details. The Freedom Convoy has raised over $5 million on Give, Send, Go, a Christian crowdfunding website, after GoFundMe removed the convoy's donation page on Friday, citing violations of terms of service. GoFundMe representatives said that campaigns which encourage hate, violence, discrimination, or terrorism will be shut down. They are in the process of refunding nearly $8 million to donors. The convoy organizers say they have no ties to hate groups. They aim to raise $16 million on the new Give, Send, Go site. The platform has previously been used by far-right groups, including the Proud Boys and participants of the January 6th Capitol insurrection. The truckers have been rallying in Ottawa and other cities since January 28. The Canadian Interfaith Conversation is celebrating UN Interfaith Week 2022 with a call for stories from Canadians of different faiths. A digital platform named Another Story will publish narratives centered around the themes of tension, cooperation, contribution, and heroes. The goal is to highlight lesser-known stories of people of faith. The organization will spotlight the top 10 stories from each faith community. The platform will provide religiously diverse resources for educators. There will be guidelines on how to encourage respectful conversations between groups of all faiths. The deadline for submissions is March 13. Fauzia Baig has been appointed as the first Director of Equity, Diversity and Inclusion in the region of Waterloo, Ontario. In her new position, Baig will help combat racism and oppression and strategize to overcome systemic racism in the community. Region of Waterloo's Condominium Authority of Ontario, Bruce Lochner said. Baig previously co-chaired the Mayor's Task Force for Equity, Diversity and Inclusion in Kitchener and is a board member of Coalition of Muslim Women. The appointment follows a recommendation from the region's Anti-Racism Advisory Working Group. A new online platform called Islamophobia has launched in France and will instigate discussion, says one of its founders. Rafik Shakat, a graduate of law and political philosophy, says that the legitimacy of the term Islamophobia was rejected for years by those in the public sphere. Shakat says that the platform will address the political, economic, social, and psychological aspects of Islamophobia, along with its effects on Muslims and their daily lives. The content will be free of charge. He says that this is a great way of showing that European Muslims will not be silenced and that they have not given up. That's it for the news. And now a conversation about a very heavy and very difficult topic, something that's taboo that we often don't talk about, suicide in the Muslim community. With us today, Imam Abdul Hai Patel, a chaplain amongst many other things. Welcome to the show. Assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh to all the viewers.
We know that Islam teaches us that suicide is forbidden. Muslims, unfortunately, feel so stressed or desperate or whatever the story is, and they do take their own life. So it is a thing that's happening, something that we don't like to talk about at all. Please, can you tell us the situation, what's happening in the Muslim community with regard to mental health and suicide?
Well, suicide is a subject that, thank you for giving me this opportunity to share my experience and knowledge on this subject. Suicide is growing across the country, especially in the last 2 years since pandemic has begun. And Muslim community is also included in that number, unfortunately, that is making up the high rate of suicide, ranging from adults, seniors, and students in university and colleges as well. And most recently, just last month, I think when a Muslim paramedic told my doctor that there has been a tremendous increase in mental health and suicides in the patients that they take into the hospital. But that also included, I believe, Muslims as well, because generally this is a topic not talked about. It is a stigma to even talk about it. So a lot of cases are not reported.
Stigma. Well, I just think that it's probably a good idea for us to put a trigger warning. This show is going to cover some heavy topics. We are showing periodically the hotline for Nasiha. If anyone feels overwhelmed by this conversation, they should stop watching and call the hotline. Can you tell us?
I think that's a good sound warning that you have given, because when I took suicide training on suicide, the number of times they say they watch you, that if you want to go to the washroom, you just have to signal them, and they will follow you. So that people, even while being trained counselors, that they can develop that tendency. So I'm glad you sounded off that warning.
Thank you. How do we deal with a topic that is considered forbidden by Islam, but the Muslims are doing it? How do we talk about it? How do we handle it?
Well, it's a difficult conversation, no doubt, but conversation has to start on mental health, because there are a number of factors that can lead to suicide. One of them is mental health, depression, and loss of interest in living. This among seniors, the isolation, emotional breakdown, and also in the family, domestic violence can contribute, as well as the stress that many of our university and college students, even now high school, among young teenagers in schools, are also, plus the opioid crisis that we have in the country, that many are taking just to relieve that stress or get away from all the problems that they may be facing.
This is, the pandemic is obviously new, but the human beings have lived for a very long time. How has our tradition, our Islamic scholars taught us to deal with this sad story of suicide?
Well, Quran says, وَلَا تَقْتُلُوا أَنفُسَكُمْ, don't kill yourself. And in Surah Al-Ma'idah, chapter verse 32 also speaks very clearly about killing somebody else or saving someone else. So saving life means that we have to watch for the signs of suicide in family members or among friends, co-workers, that there are a number of signs that we need to observe about, say, while they are withdrawn.
So maybe you should give us a quick rundown of a few signs, top 3 or 4 signs.
Well, if they are not socializing, number one, at workplace, let's deal with workplace. If they are saying, I'm not coming to lunch, or they are not talking very much, not joining coffee breaks, those are some of the signs. Then you may see signs of violence if there is a face like a black eye or anything like that. They may be wearing glasses to hide it, and other bruises that they may not be wearing short sleeve dress, that they may expose the bruises on the family. These children and students not coming out of the room, that's number one. Dropping courses, failing grades, all these are signs that you can see. And university staff at the U of T, I can speak of since I'm a chaplain there, that they are now training admin staff, and you as a professor and academic as well may have had the training, that why students are not doing well in the class, why they are missing classes, why they are dropping the courses. So before you could drop a form for withdrawal of the course, now they said, engage in conversation. They are asking staff, talk to them, say, why are you dropping? What is the reason why the grades are failing? All these questions that ask, and offer them help wherever they can. So these are some of the signs that withdrawal. I had once I gave a khutbah on mental health a couple of years ago, And one brother who came from Boston, he said his brother hasn't not come out of the room for 20 years. So he come to visit. So there is help available, and family members have to watch out and get the help as soon as possible. Don't wait too long.
So why is this a taboo topic? Why don't we talk about it?
Well, it is something that embarrassment, number one. People think will gossip. They will make fun of the person for if they are going through depression. Depression, postpartum depression especially, is not very common or commonly known or experienced in some cases in many countries. Over here, there a lot of people go through that. A lot of women go through postpartum depression, and it's not known for people how to deal with it. There is another issue as well, that when such depression or something that they are facing serious problems in the family or financial or anything, they go through that cycle of mental uneasiness, and they think that they are being possessed. I have been a chaplain at Cam H and Whitby Mental Hospital, and people sometimes ask for ruqya. And they said, I am possessed, so I need to have this thing. So they spend a lot of money. Up to last week, I had a call from one sister saying they're looking for someone to do ruqya, and they have already paid like $350 per session number of times and no cure. So people blame the possession of the spirit genes, and we cannot deny the gene existence or evil spirits and so on. But at the same time, medical help is needed a lot of time. The other issue is a lot of people, when they want medical help, they have to go to psychiatrists or psychologists, and they need referrals from the family doctor. With all these walk-in clinics that have sprung up in the last 30 years or so, people don't have a family doctor, and the referrals is always not available.
So I imagine that a lot of people come to the imam. You mentioned that they tend to think that there might be a possession by an evil spirit rather than going to see a secular social worker or something. I imagine that a lot of imams get people coming to them with these issues. Imams trained, you mentioned that you've been to suicide prevention training. Are you unique in that? Is it a topic that imams train and learn about?
No, most imams, they are not counselors. They are not trained. And they need this training to guide them. That yes, not just they're not. We cannot claim ourselves to be expert in everything. So referral is always that option for any imams or any counselor wherever there is the need. So I would suggest, request, and we have had training for counseling imams, a short overview, not really a training, but imam need to training this assist. There are courses available through number of organizations that can offer, like assist and suicide, safe talk. So these then there are others as well. They need to explore that wherever they are, whichever provinces they are living, or whatever part of the world they're listening this program. That they need to look, find the sources, and we train to guide the people, because community members, imams can easily spot someone who is not like 5 times prayer is a good way of keeping in touch with community.
Right.
And if an imam sees somebody missing for 1 or 2 days, it's usually imam or friend should inquire say why that person is not coming into masjid and what is the problem, if they are physically ill or mentally ill or whatever the reason, and then find out what help can the imam give.
Right. And unfortunately, this is just barely scratching the surface of this topic, but we're out of time, and we thank you for coming on the show to telling us what you know about this. I'm sure we didn't even scratch what you know, but thank you for the little that we had.
Well, yes, I hope you will continue to talk with other imams or experts on this topic, because it is something that can save lives of many people.
Inshallah. Thank you. Yeah. Thank you.
Well, thank you very much. Assalamu alaikum.
Wa alaikum assalam. You've been watching Canadian Muslim News on Muslim Network TV. Share, like, and subscribe. Stay tuned for the next episode. Stay safe and God bless.